with an MRI scan, you can pick up cartilage injuries, meniscal injuries, ligament injuries, and you can also look at the bone and see if there's any edema in the bone. Edema in the bone, it's like, you could say, bleeding in the bone.
Wow, bleeding in the bone.
Hi, Dr. Casey Ang. Welcome to Disney Channel.
Right. Thanks,
Part
Tony.
2. All
Good to be
right. Good to be back, sir.
Yep.
Yes, how are you today?
Good, good.
Give me a
Feeling
5,
good?
sir. Give me a 5. Oops, you missed it. So we're on Disney Channel. All right. What's up, Tony?
So, today we are going to talk about cartilage.
Ah,
Cartilage
Cartilage.
injury.
Yes.
Do you know cartilage?
Honestly, I thought ACL was advanced Chinese language. If you guys remember the previous video, cartilage, it sounds like a tendon that you eat in the Chinese noodle shop. I'm not sure. It sounds like that. Some beef cartilage, right?
chicken cartilage.
Oh, okay. I see. I'm not sure.
One of my favorites.
So you like chicken cartilage?
Yeah, yeah.
Wow, you're a cheap person.
Jade
I
Palace
love it.
restaurant does it very well.
Jade
Yeah.
Palace.
Yes.
Name it. Dr. Say one ho. Go to Jade Palace. Food must be good. Right,
So
doctor?
you should get a discount for this, man.
Oh,
for
discount.
promoting them, yeah.
Yes!
Okay,
Woo!
well, yes, cartilage,
So
one of my
hi.
favorite topics.
All right, what is it about?
Well, we touched a little bit on this in our previous talk, as you remember. Okay, so first of all, what is a joint? A joint is the area between two bones.
Oh, yes, I remember. Shoulder,
Correct.
knee, elbow.
Correct. Yep. So every joint in the body moves. Every joint in the body has cartilage. So cartilage is a special layer at the end of the bone. It forms the surface of the joint. Why is it important? Because, as you can imagine, throughout your life, you cycle the joint millions of times. When you walk, when you play badminton,
Like
when
this.
you play tennis, when you move.
Like this too.
Yeah, even when you like make a fist, you are cycling the joint. So joints need this special protective layer, and that's called cartilage.
You mean the joints? This is called joints as well.
Yeah.
Every area between two bones is a joint.
Oh, I thought my teacher taught me that when you will see the word cartilage, right? There's the word car inside. So it means movement. That's what they taught me to
that's
memorize
correct
the
also.
word. Is that
Wow.
correct?
I'm not sure. That's a good one.
Okay, so you can give her a promotion.
I
Well,
think so too.
Yes. So what's up? So what is it about the cartilage that is so important for our bone? Like, just specify it.
Well, cartilage is very important for the function of the joint. Yeah, so it protects our joints when we move our joints, when we walk, when we play badminton, when we play games. So why is it so important? I think the important thing it's important because it wears down. It can get injured, right? Now, if cartilage was, say, indestructible, if nothing could injure cartilage, if cartilage does not wear down, then we would have no issues. Then our joints can just keep on moving forever, right? But cartilage is susceptible to injury. It is susceptible to wear and tear. It is susceptible to aging. So as we get older, our cartilage will wear down a bit.
Okay.
There are also genetic components. So some people just have cartilage that wears out faster than others. So because of all these reasons, cartilage becomes a very, very important part of an orthopedic surgeon's life.
What is the most common cartilage injuries that you treat?
Well, okay. So that's a good question, Tony. When you say injury, right? What do we mean by injury? Because when you walk around, you trip and fall, yeah, you can get injured. But sometimes we also talk about repetitive injuries. Okay, so you do something constantly, time after time, time after time, time after time. You can also get injuries from that. Sometimes you can get injuries just from getting older. Okay, so spontaneous injuries. Degeneration, correct. So degenerative tears. All of these are injuries. So, it's quite a large topic, probably beyond the scope of this short talk. But basically, many ways that cartilage can get injured.
Like I treat a lot of cartilage wear and tear in the spine, but what about you?
Yeah. So knees, again, the knees hold a special position in our body. It's a connection between the rest of your body and your feet. So lots and lots of wear and tear goes through the knees every time you run, walk, jump. All of these things will have some impact on the cartilage.
Yes.
I see. Before we go into the meat of this whole entire cartilage thing, right? Just funny thing, because we talk about the movement of the fingers, right? This also involves cartilage, right? My friend actually just raised a funny thing, was that he said if you, for example, when you move your fingers in a certain way, right, it can actually affect your whole body. For example, what I remember was that if your eyes feeling a bit tired and a bit blurry, right, do this to your fingers, do this, something like this. And it's supposed to help you, just do it to your fingers, supposed to help you see and feel better. And for example, let's say your leg is pain, your knee is pain, do something with your hands and then your leg will feel better. Is that true in a medical sense? Is that true?
I have no idea.
No idea at all.
I cannot explain it.
Nothing also.
No.
So this kind of thing, they say it's got a lot of views on TikTok when someone talks about this hand movement, finger movement, and it's supposed to, when you move your fingers, it can heal your body, something like that. And so it's not medically proven.
Have you tried it yourself?
I tried. I don't feel anything. Well, when I was still in National Service in NS, I was about 20 years old. So I was climbing the staircase up to the roof of my camp with one of the vendors that came into my camp. Okay, he was an old uncle. He walked up the stairs with me from level 1 all to level 7. All right, and he told me this: "Oh, 小弟啊，我脚很痛啊, my leg very pain." Because go up the staircase, say then in my heart I was saying, "Wow, my leg pain also, but I'm only 20 only. How can it be happening, right? I'm so young, eh." Then I realized when I was walking on the staircase, there were a few times where my knee kind of had this lock, so it couldn't want to bend. It didn't want to bend, and whenever I stepped down or stepped up, there was this pain on my right knee, right? And I wonder where's it coming from. I'm only 20. I'm so young. How can I be getting any of this nonsense, right? But after a while, it goes away. And for example, when I was 22, it came back in for once in a while. It came back once in a while. So it's not something that's occurring every day. No, but it's just I want to ask,
After NS go away.
After NS?
Went away.
No, it didn't. Sadly, that one didn't. But so when someone having some knee issues or some cartilage problems, right, correct? When should they be alarmed enough to see a doctor? Or maybe what can they do to solve the problem quickly? On the spot, maybe.
Yeah. Good question. So, we all get pains here and there, right? Every now and then. So, we can call it the LCT syndrome, long zhong tia, everywhere pain.
Long zhong tia.
Yeah. Long zhong tia.
Yeah.
Everywhere pain.
I didn't know that.
You ever heard this?
Never heard of it. Okay, long zhong tia.
Yeah. In German, it's called the Unhia syndrome.
Oh, what? In what? In German?
Unhia.
In Unhia.
Yeah. When you have pain here, Unhia. Any Germans in the audience?
My goodness. Then if you have pain, how?
Oh, that's called lovesick.
Lovesick. Lovesick. All right.
Okay, so
Yeah.
it is common for people to occasionally get issues with their knees. Let's say knees specifically, right? It is common for people to get issues, and there can be a whole, as we discussed just now. You can get locking, clicking, pain, swelling, right? When do you need to see a doctor? I think in general, if something goes away quickly, comfortably,
In one day?
one day, few
Or
hours,
2 days, 3
or
days,
2
1
days,
week
maybe, yeah.
1 week,
yeah.
so 1 week is
Easily,
short,
yeah.
right?
Go short.
So
It goes
mathematically
away
speaking,
quickly.
1 week is short.
Yeah. And it goes away comfortably, right? What do I mean by comfortably? It goes away, and then you don't feel it anymore. You feel fine, right? So I think that you don't need to see your doctor.
Okay.
But let's say it goes away, and then it comes back again, right? Then it goes away comfortably, and then it comes back again. Then
Without any obvious reason.
correct, yeah. Then you're kind of thinking, oh, what's going on here? Or sometimes it's with an obvious reason, like you were saying,
Injured again.
up and down stairs, right? So you go up and down stairs. Every time you go up and down stairs, there's a problem there. Then maybe you should get that checked out, right? Of course, pain is also a very important consideration. If you have a lot of pain, you need to come in and see one of us, yeah? If you have locking, and I said locking is very, very disturbing to the patients. Locking, I think generally I would say you need to get that investigated. Yeah? Clicking, as we said, if there's no pain, goes away, doesn't bother you too much, then there's no need to. So quite variable. The bottom line is, if you're not comfortable, no harm going in to see your doctor.
Could there be a link, between like the knees locking and between the idea of, asam urat?
Asam
What do you
urat.
call that in English?
Asam urat gout.
God.
Oh,
Gout.
God.
Gout.
God.
Gout.
Is there a link between knee locking and
no,
gout?
no, not really. Not
So
really.
there is no like. So if someone has asam urat and they have knee locking, it's not.
No, not really.
related.
Not really. Yeah.
Oh, I see.
Locking is usually a mechanical problem. So there's a tear somewhere, either a tear of the meniscus or a tear of the cartilage. So that causes locking.
If you have a big meniscus tear, right? Back at handle tear, you mentioned last time, it lock. I can understand, but for cartilage, how does it lock? Well, if you have cartilage injury,
Pain. So sometimes because of pain, yeah. And some cartilage tears are quite large.
they got stuck in
The fragment can flip and get stuck.
Oh,
So that can also cause locking. Sometimes you can get a loose body in the knee, right? So a piece of cartilage breaks off, then it floats around the knee. It's called a loose body.
Wow.
And that can
That
get
happens.
jammed. Yeah, that can get jammed between the condyles of the knee. So that can also cause locking.
Sorry, the condyle.
Condyles, that means the knees.
You mean a muscle can tear,
No,
No,
the
the
cartilage. The
the-
cartilage.
the-
The
the
cartilage.
and then it can float between the
It
knee.
can float inside the knee, yeah.
Huh, float.
Yeah, it can float around in the knee.
And then it gives you more problems.
it's like fluid in the knee, then the fragment floats around and got jammed.
Oh, wow! I never heard of that before. That is interesting. That's a fact to know. Learn that because doctors say one, right?
Yep.
Doctor, then so how do you diagnose cartilage injuries? Yeah.
Right. Now, most of the history is taken from the patient with regard to their symptoms, and then we examine the patient. We look out for signs and all that. But really, in this day and age, the most important mode of diagnosis is a scan. Yeah?
Ooh.
So for cartilage injuries, an MRI scan. If we suspect that there's some bony pathology that we need to have a look at, then we do a plain X-ray. But by and large, an MRI scan is the definitive diagnosis
Bony
or mode of
pathology.
investigation. Sorry.
Wow. I
MRIs to see any soft tissue injury.
Correct. And it gives us an idea of what's happening in the bone as well, right? So and with an MRI scan, you can pick up cartilage injuries, meniscal injuries, ligament injuries, injuries to the capsule. You can pick up fluid in the knee. And you can also look at the bone and see if there's any edema in the bone, right? So edema in the bone, it's like you could say bleeding
Swelling.
in the bone.
wow, bleeding in the bone.
Is in layman's
Inflammation
terms,
as well.
yeah, in layman's terms. Yeah.
Wow, I heard this so many times already. I feel like I'm upgrading my knowledge. I bet you also upgrade your knowledge. Open your mind bigger, live your life higher. All right, doctor. So, right, so that's how you diagnose those injuries.
Correct.
Right? But are there any tips that you can give to our dear audience, how can they sayang their knee better and prevent some of these injuries? And give you less revenue lah.
We discussed this in the previous talk. Every day is leg day.
Same thing again.
Yep.
So get to the gym.
Hit the gym, keep your legs strong.
Actually, is running considered as a leg thing? Someone in Singapore there's things called the running clubs. Right? So they run because
Running is
they're
good. Running
Is
is always good for
you know?
building muscle. Yeah, of course. Yeah,
Is
but
it
of course,
leg day?
running is also there's a lot of impact with running. So
yeah.
you have to be careful when you run. You have to choose your running surface, your shoes. You have to make sure you're strong enough to run. A whole lot of factors.
A lot of people believe that if you run a lot, your knee will get damaged.
Yes. In fact,
Yeah.
people ask me on my Instagram,
Is it myth or
is running
or-
bad or good? Let's decide.
That is actually quite controversial. I'm almost afraid to say anything in case we get a whole lot of
Runners.
ugly comments.
athletes people?
Chase him down. Chase him
We
down.
might get slaughtered by people who run or don't run. I think running is a great sport.
Yep.
Being
I
safe?
think that I'm a believer in genetics. I
Oh,
think
me
that
too.
some people are just built to run, and some people are not.
Oh.
So I tell everyone to run to their own potential. Listen to your body. Yeah.
Yeah.
If you like running on treadmill and you're fine with that, great. If you like running on road, but you have issues after, say, 10 kilometers or 5 kilometers, then I think you need to
Stop there.
redo your maths. Yeah, you need to decide
I
how much
see.
time you're going to spend on road, how much time you're going to spend on track, how much time you're going to spend on the treadmill. So
see.
no hard and fast rules. Running, great sport, but of course you don't want to overdo it. Listen to your body. Yeah.
I see. Doctor, one last thing is to ask you, right? What is your recommended or favorite running shoes?
Well, again, I'm too scared to answer that question.
Oh, come on, come on. No, for me, I'll put it out there. I love the brand new On Cloud Monster 2. The energy return is great. The shoe
my
is
God.
amazing. I use it and, I recommend it. Go for it. Or the Nike Vaporfly 3. That's also pretty good. But that is carbon plated, so you may want it just for competition and your marathons. Use it wisely.
That is amazing because if you had to push me, I would also say Cloud Monster.
Whoa, whoa,
Yeah,
whoa.
great pair of shoes.
All right, talking about running. So he was running away from talking about running, and now I pulled him back. So now I'm going to talk about running. So what about the surface of the running that makes the difference? Do you burn more calories when you run on the road compared to the treadmill?
Yes, you do. Right?
Ooh.
Because when you run on treadmill is actually easier. The surface is easier, which is what I like post-surgery or when patients
Okay.
are recovering from injury. But of course, the surface is moving, right? It's giving you a hand, right?
So it's helping you move.
It's helping you move.
Oh,
so,
okay.
Right? So naturally, you don't use as much effort, and you're going to burn a little bit less calories, right? But as a start, after an injury, after surgery, I prefer starting my patients on treadmill. So my regime for returning to running is to get them onto a treadmill to do brisk walking, right? 4 to 5 clicks per hour. So they do brisk walking first. If they're comfortable with that, then they'll do a slow jog. If they're comfortable with that, then they'll do a fast jog. Once they're good, then I let them go to a running track.
Running
So they drop back down to a brisk walk, and then a slow jog, then a fast jog. Once they're good with that, okay, then they can go on to road. Same thing, they come back down to a brisk walk, slow jog, fast jog.
Brisk walk, slow jog,
Fast jog.
fast jog. And remember, treadmill is the easiest one.
It's easiest, and then
Track.
running track, and then road.
Road.
Yeah.
Singapore has many running tracks, by the way. Running fields, right?
Yes.
It's really nice to run there. I love to run there in the evenings, doctor. Very nice. You feel like a racer for a while. But just in my dreams, right? Dream on. So, talking about that, so we talk about the running track. Great, right? Now, how about the running shoes?
So,
Yeah.
I'm not going to promote any particular brand of shoes.
We're not paid to promote, right?
Yep.
We're not paid to promote. Yeah.
Personally, I like the Cloud Monster.
Woo!
For jogging, for running, but also, I'm a believer that you can use different shoes for different things.
Okay.
So I like skipping, right? So skipping is one of the ways that I like to stay fit with. And when I skip, I like to use New Balance
New Balance.
or Brooks. New Balance
Brooks.
or Brooks.
Oh, Brooks.
Yeah.
Okay, right.
I've tried skipping with other shoes. I've tried skipping with I had a pair of Hoka, which was nice for walking, but I couldn't skip in it. It felt too stiff. But maybe it's the brand or the model. Maybe
I
it's
see,
changed
I
model.
see, I
So
see.
I think within every brand there are also different models. But definitely for skipping, I like Brooks. I used to like Brooks for running, but then the later Brooks models, I seem to be having trouble with it. That's why I went to Cloud Monster.
Cloud Monster. So these are good shoes that you will like for.
I think all shoes are good. You just have to find the right one for yourself.
Right, I see. How about you, Dr. Tony? Which pair of shoes do you recommend for running?
I don't run, but I play badminton.
He runs in my mind.
And I don't change shoes so often.
Really?
No. I like if I have a nice shoes, then I just wear it again and again until it's time to change. Then
so
I
you
change.
have 5 pairs of the same shoe. Eh?
No, just one. Maybe then if it is worn out, then I change to another one. But I don't have
we should
like 5
brainwash
different
him.
types of shoes.
Okay.
Oh, we should brainwash him, man. I got a pair of Under Armours meant for HIIT, you know, those gym classes. I got a Project Rock for weightlifting. Therefore, the stability is important. In fact, Nike Metcon is so stable for weightlifting. That is perfect. I think it's good for your knees when you do
Project Rock.
squats.
What brand is that?
Under Armour.
Under Armour also.
Under Armour,
Right.
yeah.
Under
That's for
Armour.
the Project Rock one.
Right.
The newest PR6 model, go and check it out. That was really stable for weightlifting. You know when you do weightlifting, right? You gotta for the sake of your knees. You have to be careful as well, right? You have to be stable. You have to close to the
Definitely.
ground.
Yep.
You have to feel the ground, right?
Yep.
Yeah, and so if you don't, what will happen with your knee? You know,
You could lose control. Yeah.
you could lose it, right?
Yeah,
Correct.
for sure.
Yeah, and you know, doctor, like, like someone you do weightlifting,
Yeah.
if you fall backwards, right?
Wow, that's
will your
dangerous, man.
spine
Yeah, a lot. There is one person died because
Oh yeah.
the weight
too heavy, right?
just hold on the neck.
Yep, yep,
and
yep.
Oh my goodness! And then it died.
Then
That's it.
snap. Then the spinal cord snap.
Yep.
Oh my
Then
goodness!
died immediately.
What if you fall backwards with the weight? So you fall backwards with this, so then you drop
That's
the weight. Yeah.
Maybe
The
safer.
weight drop on your neck.
No,
or
like you so for
that
example
is
you're
maybe
on your
safer,
shoulders, right?
safer. You drop it backwards
Drop it
instead of
backwards.
drop it.
Or you fall down
forward.
also.
It's okay. Just let it go.
Or just let it go. Say, but you fall forward.
Wow, that's
That's
very
it.
dangerous, man.
Oh, be careful.
That's just last year, right?
Yeah, last year.
It was
That's a very famous case.
Yeah.
It's,
It's,
someone from Philippines or
Indonesia.
Indonesian.
Indonesia.
Oh, Indonesian.
And he's quite a
Yeah.
famous guy.
Famous guy.
Yeah.
Famous guy. Quite sad.
And
Sad
spinal
story.
cord snap
Snap.
Really?
Died immediately.
on the spot.
On the spot.
Will you feel any pain if you?
No, I'm not sure, but maybe I don't know. But died immediately.
spot.
Cannot breathe.
Yep.
Oh, right.
Scary, man. Scary.
That is very grim. But back to the running
Oh,
shoes
right,
one.
yes.
Right.
By the way,
So,
can I ask you, how many shoes do you have?
for me,
Sports shoes.
sports shoes.
Sports shoes.
I think I got about 4, at least 4.
Are you sure?
I
Only
guess 4.
four?
Yeah, for now, at least 4. I used to own like 2 pairs of Hokas for when I first began my. I mean, you know, if you all know, I lost 40 kg.
Wow.
And so
Really? Wow.
yes, in 4 months I lost 40 kg, and I first started out with Hoka first. That was one of my first running shoes that I began running first. From then I progressed forward. I changed to different shoes. I tried different
Can we see some
shoes.
photos?
We can see
Yes.
show your photo
Yes.
before and after.
Of course, we
But
must.
you must be very proud of it.
100% ups. Right. I mean, it was a tough journey. But from there, I began to be equipped with the right knowledge. Because your shoes are important, right? For your knees.
Indeed.
Your cushion is important,
Yep,
right?
yep.
Even for my dad now, is getting, my dad's now getting on the age as well. He always wants shoes that have cushioning. Because he said it's better for his knees.
For
right?
sure.
Does
for
that
sure.
help?
Yes, definitely.
It helps, alright.
Definitely,
It helps
yes.
a lot. Yeah, in fact, how about like how about those shoes that are carbon plated? What do you think? Those shoes with a high foam, high amount of
I just
foam.
have no experience with those.
No,
Yeah.
no experience. I see. Carbon-plated shoes may wear out fast if you use it every day. It's not a daily trainer. So you want to run every day, stick with the daily trainers. I'll recommend Uncut Monster.
Oh, totally.
Monster 2.
Sounds like you have sponsorship from there,
Oh,
man.
I'm
Or you have
not
shared.
paid. I'm not paid.
Share in the company.
Oh, but you should,
Yeah.
sponsor me. ON. Yeah. Sponsor me. Sponsor us. Right? Give us some shoes.
I'm gonna run out
Yeah.
right now after this and buy myself the
Woo!
Cloud Monster 2.
Yeah, good. Oh, by the way, get yourself a membership at Running Lab. You're gonna get 10% off.
Oh, really?
Your purchase, yeah.
Cool.
Fantastic. So, doctors, my father, my mother, my auntie, uncle, grandparents all take one thing in common. Glucosamine. Today, let us all know, does it really work?
Good question. So, when you say, does it really work? What are we asking? Does it really work to help reduce pain? The answer is yes. Glucosamine is actually, you could say, a natural painkiller. Some people who take it, their pain gets better. Now, it could be placebo effect, we don't know. But anecdotally, a lot of people who take glucosamine feel that their joint pain gets better.
Okay.
But if you ask, does glucosamine heal your joint? Does it make your cartilage younger or better or stronger? Then the answer is no. Doesn't do that. All right? So now in my practice, I do give glucosamine. I like to give it to older patients who've got bad knee pain, but they also have other medical conditions, and I don't want to give them, anti-inflammatories or painkillers that are too strong, right? So I want to be gentle with them. So I offer them glucosamine, very safe, right? But do you give it to a young patient? No, there's no point, right? Because young patients can tolerate other more effective painkillers better.
I see.
Now, is it going to heal their cartilage? No. I tell them, straight off, it's not going to heal their cartilage. It's not going to do anything to their cartilage, right? So that's glucosamine.
How does the body weight affect the health of the cartilage? For example, if they are overweight, obese, compared to thin people like me.
The tiny.
Okay, so this is another dangerous question, right? I'm almost afraid to answer this question.
Okay.
And when a patient walks into the clinic and they ask me this, I sweat, I tremble, I don't know what to
Really?
say. Especially if the patient is a bit larger, then I really sweat. I'm like, wow, what should I say? It must be diplomatic,
You
must be PC. So the bottom line is, you can get knee pain even if you're large, even if you're small, even if you're fat, even if you're skinny, even if you're tall, even if you're short, right? So bottom line is, you can get knee pain from cartilage issues at any sort of body, weight, size, morphology, okay? But after saying that, it is true that once a year, I'll have a patient come in to see me, an old patient, and they'll say, hey, doctor, I was good for the last few years, but I stopped exercising, I got a bit busy at work, I put on a little bit of weight, and my knee pain has come back. Can I have some medication, and can you send me to physio again so I can build up my legs again? So this happens about once a year. So while weight is not a huge issue in cartilage problems, it is still an issue somewhat. So we need to be balanced in our diet, and we need to work out to make sure that if we are heavy, it's because of muscle and not so much fat. Yeah.
Actually, then,
Okay.
is there a cause and effect thing here? Because, for example, like my cousin, right, before she lost weight, so she was like, I think very heavy, very, very, very huge, right, in size. She had knee pain to the point that she couldn't walk. She was bedridden.
Right. Yep.
Because of a knee pain. And doctor said because she was really just too overweight already. After she lost 60 kg, back to health. 60
kg?
Yes. So,
That's heavier than Tony.
yes.
Yeah.
Yes. Yeah. And she was only 15, by the way. And she already couldn't walk because the doctor said that she was too heavy, too overweight. Her knees couldn't take it.
Yeah.
So is that... So
Well, that's extreme.
Cost,
That's extreme. Yeah, that's extreme. I think if you're like, 10 kilos overweight, I don't think it's going to be a big issue. But of course, if you're 20, 30, 40 kilos overweight, then yes, every part of your body is going to be under stress. Not just the joints. I mean, your heart will be under stress.
If I have a patient come to me, right, for back pain, sleep this, and they have extra weight,
Yep.
I tell them, and because I need to tell the truth, this is the cause of the problem. I'm different from you, doctor.
Maybe I should tell the truth more often.
Time to talk a bit about the treatment things that you should tell us about.
Right. Okay. Okay. So treatment is what every patient who walks into the clinic is looking for. Yeah?
Yes.
So let's divide treatment into two parts.
Okay.
Right? Number one, which is what everyone wants to do, and I want to do also, is to treat the patient without surgery. Right?
Okay.
Number two, the patient may need surgery, but let's discuss that on another occasion. yeah?
Okay,
Let's talk
sure.
about all the things that you can do, all the things that we can offer to the patient before we get to any sort of surgery.
Okay.
Right?
Right.
Now, I think, first of all, we can start with simple things. First we make a diagnosis. We see what sort of cartilage problem they have.
Okay.
Most of the time, the cartilage problem can be treated without surgery. So we offer them anti-inflammatories, we offer them painkillers, sometimes we give them knee guards or knee braces.
Knee guards.
We send them to a physio who can show them how to build up strength in the legs. Yeah. So I think all of these things are important.
Okay.
I like to talk to patients about activity modification.
Oh, what is that?
So make things easier. Now, if you're a keen runner and you're running 10 kilometers 3 times a week,
Okay.
but you have knee pain,
Okay.
very simple. I'd say try 9, try
Reduce
8,
it.
reduce it.
Reduce the intensity of your activities.
Correct.
Okay.
Yeah. Or maybe change the surface. Instead of road, maybe go on a running track. Or maybe go onto a treadmill. Yeah. So you can do all these little things to sort things out. Yeah. And of course, as we discussed earlier, shoe wear is also important for runners. Yeah.
Perfect.
For other people like to do hits, people like to do badminton. Then again, same thing, activity modification. Just modify your activity, right?
I see.
But most of all, and you know what I'm going to say, you keep your legs strong. When your legs are strong, you'll have less issues with your knee, whether it's a ligament injury, as we said previously, or whether it's a cartilage problem. Every day is leg day. Right?
Wow, we got the chemistry going. I like that one. So that is the non-surgery treatment
That's a
options.
non-surgical option, yeah.
Right. So from this new channel, part 2, we wanna say it again.
Every day is leg day.
Don't
Yeah.
forget to
Like, share, and subscribe.
Mad Talk Singapore. If you have any questions at all, please feel free to drop them down in the comments down below, and we surely will love to get you your answers. And doctors, let's
Together.
say it like we mean it.
Doctor Say One Ho.